This is the Chatbot Roadshow. I'm Greg, joined in the studio by Blakely and Justin. Guys, good to have you on the Roadshow today.
Thanks, Greg.
Great to be here.
So today we're going to do a demonstration of the LifeLink Make an Appointment chatbot solution. But before we get into that, let's do a little setup, a little context. So when I think of the Make an Appointment opportunity, it really is close to booking a room with Marriott or reserving a dinner reservation. It's really where healthcare and e-commerce begin to get very close to one another. And you've got a lot of these big players that are out there making noise about consumerism and healthcare, et cetera. But really, it's very important that health providers nail this because, as you can see by these numbers, it's a pretty big deal. I mean, those are significant. Nearly 100% of people are saying, we do online research and we'll switch if it's not there. That's telling.
Yeah, I think as patients, we're also consumers, and we've been trained to do online research through Yelp and other services before we make a dinner reservation or purchase a product on Amazon. And it's only natural that we do the same when we're trying to select a provider to make an appointment with.
Right. Now, there's a lot of talk in healthcare about being consumer-centric, but when you really look at it, in reality, the industry is way behind. And Blakely, in your role, is somebody that's out in the field talking to innovators in healthcare and non-innovators in healthcare. It's not a pretty picture when it comes to this, I guess is the best way to say that.
Yeah, it's really interesting to see that 72% of hospitals aren't offering the opportunity for some sort of an online appointment request. If I can't engage with any organization electronically, the chances that I'm going to engage with them at all are really slim.
Right. And Justin, am I looking at this correctly? Does that say 114 form fields?
Yeah, we won't shame the hospital that did this, but one of the 28% of the hospitals that actually did offer online appointment requests required patients to fill out 114 fields in order to request that appointment. That wasn't even to schedule it. That was just to request an appointment, which is crazy. You know, no marketer would allow that to exist on their website.
I'm a marketer, and I tell you right now, no more than 20. Okay, well, let's get into it. So today we'll break the demo into 3 sections. We'll talk a little bit about always on 24/7 access, the notion of one-click scheduling, and how this process is really at the beginning of a broader, longer-term relationship. So let's start on the 24/7, but before we go, I just have to shame an innovator in the industry. I won't name names. I was looking around in preparation for this and went to one of the providers that's held on a pedestal as being one of the most innovative health providers in digital innovation there is. And there was a chat. I thought, wow, a chat function on the website. Let's check it out. Click, and I got this message. So that's kind of shocking. I really couldn't believe it when I saw that.
Yeah, it feels like they had all the right intention, which was to expose better functionality on their website, expose chat and messaging the way patients want to interact right now, but they weren't appropriately staffed to do it. And so they ended up in this awkward medium where the functionality existed, but it ended up probably being more frustrating for patients than it was helpful.
Right. They claim it's open 24/7, but let's assume for a minute that it's 2 in the morning and you want to schedule an appointment. Let's get into how a bot might handle that.
So imagine Blakely has been having some chest pain and she thinks she needs a cardiologist. She's been looking at the Westpath Hospital website and now she actually wants to request an appointment.
So when I engage with the bot, I'm told first that it's a virtual assistant, and then I'm asked to click on an option to get started. So in this case, I want to request an appointment. And the bot sees that I've been looking at cardiologists and asks me if I have a referral. This is an important part of the process, but I'm sort of curious why they're asking me that. Then the bot delivers the information that's going to help me progress in this workflow and help me make an appointment. It's because of my insurance plan. So they're going to ask me, have I seen my primary care doctor? In this case, I haven't yet. So the bot knows that in that case, they need to find out if I have a primary care doctor or if I'd like help finding one. Many times when people go to a website for a specialist, they don't necessarily have information from a primary care doctor, and they need to have that as part of the process.
And you could imagine that those are the exact types of questions and guidance that a patient access agent would be able to guide Blakely through. And so offloading that and allowing the patient to access that type of education, even when it's 2 a.m., is immensely valuable.
So this is one of the things that I love about a bot versus an agent is my name is pretty complicated. So when I enter it into the bot, I do it and it takes me a few seconds and it's easy and straightforward and I know how to spell my name. I don't have to repeat it. I don't have to spell it multiple times. And you can imagine also if you are doing an appointment for multiple family members, maybe it's time to do a primary care check-in for 3 or 4 family members, to have to repeat that process and spell each person's name and all of their information can be tedious. And to be honest, for me, has often been a barrier to even making appointments.
Okay, so it's 2 in the morning, you've filled out all your information, and again, even with a form, you click a button and then you have to sit around and wait for somebody to call you back and confirm it. But let's talk about the notion of a one-click scheduling where you don't have to wait for a human to come and complete the process. How does that work?
Yeah, so this is one of the ways that a chatbot, when it's integrated to the back-end scheduling systems of record, can make making an appointment feel much more like making a dinner reservation on Yelp or OpenTable.
So the bot at this point knows that I've got multiple addresses in my record, and so it's going to ask me if I want to see a doctor near my home address. This is important because if I need to go during the workday, then it's going to have to be near my work address. I do want something in this case that's near home, and I'm immediately given an opportunity to make an appointment with Dr. Thomas. Dr. Thomas, I have her address, her phone number, her specialty, and also her rating, so I can see how other patients have felt about their experiences with her. So does that work for me? This time, unfortunately, is not really what I need, so I've been given some options, and I can see all of the open slots and all of the open times that I can connect with Dr. Thomas and make an appointment. So I've set the appointment time. I can add it to my calendar if I need, and then I'm going to get a reminder from the bot before the appointment. This is really helpful for me in my busy day because, even though I made this appointment, I might forget about it by the time it rolls around. And I also could get some additional information that's going to make it a little smoother in terms of getting to the appointment, such as the weather looks like it's going to be okay, but if there is a chance perhaps of rain, some of this information can be added to ensure that the patient knows everything they need to know prior to the appointment and that they can get there as needed.
That conversation that Blakely just went through in a minute, you could imagine might have been 3 or even 4 phone calls and a game of phone tag between the patient access manager, the clinic staff, and Blakely to try to lock down that appointment date.
Cool. Okay, so we've booked it. We have an appointment with a primary care physician. But that's not really the end. When you're dealing with something, especially like a cardiologist visit, you're probably at the beginning of a journey into a longer term experience with the provider. How would the bot stay with you and go on as you navigate?
So the bot, again, knows my name, and it can address me by name when it's checking back in to see if I can still make the appointment that I have scheduled. In this case, I can. And then the bot can go one step further, which is ask me a few questions that'll help prepare for the appointment. So if I have time right now, I can do it, which I do. If I don't have time, the bot can reach out later. So I'm given a little guidance about how long it's going to take so I don't get frustrated by the experience. And these answers are going to not just help me be prepared, but help Dr. Thomas be prepared.
And connecting that appointment request to eventually the appointment reminder and the intake that Blakely has to do before the visit will make her process and experience that much smoother when she gets into the clinic. She won't have to sit in the waiting room and fill out all those forms by paper. Dr. Thomas will actually be prepared with all of the health decisions and factors that Blakely wants to talk about.
Right, and this goes on, as you can see here in the slide on screen. But there are a number of different workflows that flow out of this initial touch.
That's right. And at this point, probably after the visit, Blakely has talked to the bot 6 or 7 times. And to be able to deliver that level of engagement and touch across all of your patients, if your hospital system, can be transformative for how Blakely perceives the hospital for her and her family.
The connection that a patient makes with the hospital can make a difference as to whether they stick with that system, whether they're willing to go to a new doctor that they don't know anything about because it's recommended from someone within the system, and whether they're going to refer friends and family members also. Again, if you're a person in the family who is in charge of making appointments for multiple family members, it can make a major difference in terms of making new appointments for additional family members. Perhaps it's aging parents that don't have primary care doctors. Perhaps it's nieces and nephews with cousins and small children that have never, need a new pediatrician or have never been to a doctor and they need to connect with the system. You're certainly going to recommend someone who you have a close connection with and whom you trust.
Right. So if you're interested in seeing some of the other LifeLink modules, products that address some of these other areas, they're available at lifelink.com in the resource library. So go check it out. And if you're interested in seeing a solution like this in the real world, there was a press release put out by LifeLink about a chatbot for making an appointment at Jefferson Health. And really the big thing here that stood out to me was how much the chatbot outperformed online forms. So Jefferson was one of those hospitals in that 28% that did have an online form. When they did an A/B test with the chatbot destroyed it in terms of getting people through the process, which is a pretty big number.
Yeah, the fact that the bot outperformed an already mobile optimized responsive form by 150% is incredible. And that's partly because when you're talking to a bot, it's guiding you through that experience. It's asking you one question at a time rather than staring a whole form in the face. You're able to have a much smoother experience where you can ask the bot questions and can help guide you through that experience.
Okay, well, thanks for joining me on the Chatbot Roadshow today. We'll be back with more demos. Thanks again.
Thanks for having us.
Hope you've enjoyed this episode of the Chatbot Roadshow. You can find other hospital, pharmaceutical, and research solution demos in our resource library at lifelink.com.